Hi guys, welcome to this week's lesson. We're going to be diving into the thorax and the breast. So moving down in the body, we started with the head, then we went to the neck, now we're going to go to the thorax. The thorax itself actually starts from your clavicle and it goes all the way down to your last rib. And obviously the breast is a part of the thorax. So starting with the external landmarks. And we're going to look at the thorax first. So obviously we're looking at muscles. The muscles that are lying right under the superficial layer, which in our case is the skin. When you're looking anteriorly, we're going to be focusing on the muscles and bones that are most superficial, which would be in this case the clavicles, or the bones that are very obvious to mark the beginning of the thorax. So your clavicle. Right attached to the clavicle, you have your pectoralis major, and it actually, let me reference the book here. Your pectoralis major, it's attached to the clavicle, and it also attaches to the the costal cartilages, so your ribs, your top 5 ribs, and then underneath the actual pectoralis major is where you can find the pectoralis minor. So I found this picture for you guys depicting that. The pectoralis minor is underneath this large pectoralis major. You guys know this. I mean, I'm sure you guys have gone to the gyms. You guys see the pecs and the pec dance, and you can think of like The Rock doing his pec dance. He's moving the pectoralis major muscle. Underneath that layer is the pectoralis minor, and then finally the deltoids. The deltoids are your shoulders, so your shoulder muscles. When you do a lot of things like raising your arms up, you're exercising these deltoids. For posterior landmarks, these are all the things that are referenced in your book and in the chapter. So for posterior landmarks, we're going to start with the trapezius muscle. We talked about this muscle in the neck. Why? Because it actually extends all the way from your external occipital protuberance, so all the way from the EOP up here, and it looks like a trapezoid. That's why it's called the trapezius muscle. And it starts at the external occipital protuberance. It actually attaches, if I'm not mistaken, let me double check, to your it actually attaches to your T12, so it goes all the way down to your T12, your T-spine, and then laterally it attaches to your shoulder. So this is the trapezoid right here, okay? Or trapezius, I'm sorry, the trapezius muscle. Your teres major muscle is right here, or sorry, it's this little one right here. And your teres major it's inferior to the scapula and the humerus. It actually helps form like this back part of your axilla. That's where your teres major is located, where it is located. Your latissimus dorsi, these are your lats. When you're doing those back pull downs, those lateral back pull downs, you're working out your lats. Your latissimus dorsi, very large muscle in your back, and it starts on the iliac crest all the way to the axilla. So we're talking down here, the iliac crest, all the way up into your axilla. And it attaches all throughout your back. The crest of the ilium, so your iliac crest, what we were just referencing, it's these little butterfly-shaped wings on your pelvis. That's your ilium, and that's the crest of your ilium. And then the other reference point that your book talks about is the posterior, I didn't write that right. It's your posterior-superior iliac spine. Sorry for the typo there. Posterior-superior iliac spine, and this is a point in your sacrum. Yes. And it's where your iliac attaches to your spine, in this case, the sacrum. Those are the points of reference for the external landmarks. The internal landmarks of the thorax. So at this point, we're starting to look more about the airway. So starting with the trachea, the airway, remember this is an x-ray. So x-rays, 2D images, and x-rays are similar to CT scans where the bones appear white and air appears black. Where you can see this little channel, this little tube coming down between the two lungs, that is your trachea. Where the trachea bifurcates is known as your carina. So this little Y shape here, or upside down Y, that's your carina. Very important that you know that. You're able to see your lungs, which are obviously these black encasements here on either side of your body. Your heart is off to the left. Your left lung is smaller than your right lung. It only has 2 lobes, whereas your right lung has 3 lobes. This right here, or right the inferior border of your lungs, is what we call the diaphragm. It is a muscle, and if you remember from before, your diaphragm is the muscle that separates your thoracic cavity from your ventral cavities, or sorry, from your abdominal cavity. And actually, right beneath the diaphragm here, this black air here is not from your lungs. It's actually from your stomach. So the picture does point that out for you guys. And then, of course, you can see the vertebral bodies all lined up very nicely. You can see this is T12 because this is the last rib. It's a floating rib. After this, this body has no rib articulating to it. So you know that this is L1. The lumbar spine has begun. Okay. All of these landmarks are incredibly important, and we will go over these in e-contour videos. I think it's so important that you guys are familiar with what the thorax looks like in 3D view. All right, so the lymph nodes of the thorax. The mediastinum, it's kind of like this area right above your heart and between your 2 lungs. That's what the mediastinum is. And it has a rich intercommunicating network of lymphatics. So what does that mean? It has a bunch of lymph nodes, okay? And there's a certain path that all these lymph nodes take. So you have your superior mediastinal nodes. We're talking about up here. Go to the tracheal nodes, also known as the paratracheal nodes. So the tracheal nodes are your trachea. The paratracheal just refers to that they're on each side of the trachea. And then it comes down to your superior tracheobronchial nodes. That big old word, the superior tracheobronchial nodes, is superior to the trachea and the bronchi. The bronchi are where the trachea bifurcates, or where the carina is. It turns into a bronchus, the right bronchus in this case and the left bronchus in this case. So superior tracheobronchial nodes are going to be here, right? They come down this way. After that, you have your inferior mediastinal nodes. These are your carinal nodes. So we're talking right here where these bifurcation is. It goes into your bronchopulmonary nodes, also known as your hilar nodes. So these are going to be, if you see bronchopulmonary nodes, these are going to be once you, the bronchus, now we're focusing on the bronchus as it's entering the lung. That's where those lymph nodes are going to sit. And finally, your pulmonary nodes are going to be the ones deepest into your lungs. These are the intrapulmonary nodes. So all the way from the superior mediastinal nodes, you're talking up at the top. Okay, the mediastinum sits right between the 2 lungs, right up here. Goes down the paratracheal. Then from the paratracheal, you go into the carinal. From the carinal, you go into the bronchopulmonary nodes, also known as the hilar. And then they go into the intrapulmonary nodes inside of your lungs. All of this travels out of your paratracheal nodes to the mediastinal nodes, which then go into your ducts. And we're going to go further into that. So here's the lymphatic pathway. So for the right lung, pretty straightforward. All 3 lobes of the right lung drain into the hilar nodes, the intrapulmonary and the hilar nodes, which are the ones that we went over that are very deep into the lungs. Then they come out of the lungs through the bronchus to the carinal nodes. Then the carina unites to form the trachea, so it goes into the right superior paratracheal node for the right lung, goes into the right superior paratracheal nodes. Then it goes over to the scalene node. We're going to talk a little bit more about this node in breast, which is a few slides ahead. Then from the scalene node, it'll jump into the right lymphatic duct, which, as we learned from our lymphatic system, week 2, the right lymphatic duct serves the right side, the right arm, the right head and neck. So that's where we're talking about the right lung. It drains into the right lymphatic duct and finally into the brachiocephalic vein. For the left lung, you have two options. I'm going to move myself out of the way. So the upper lobe of the left lung will drain into the intrapulmonary and the hilar nodes, so the ones inside of the lung and right on the bronchus. It'll go to the carinal nodes, same, the carinal where the bifurcation happens. Then the upper lobe will drain into the left superior paratracheal node. So as it travels up the trachea, it actually will stick to the left side. It'll touch the scalene node on the left side of the body, and then it'll go into the thoracic duct, and finally the brachiocephalic vein. Remember, the thoracic duct is the other lymphatic vessel, major lymphatic vessel that serves the entire lower part of your body, your entire abdomen, and the left side of the head and neck. The lower lobe of the left lung has a different pathway. Goes into the interpulmonary and hilar, again, the ones inside the lung, the ones right outside the bronchus, goes into the carinal, and then it actually shifts, and it goes through the right superior paratracheal nodes, and it follows the drainage or the lymphatic pathway of the right lung. The reason for this, I don't have it. I don't know what the exact reason for it, but that is the way that it travels. And it's important that you know this because depending on what area you're treating or what lobe you're treating, you're going to see different field designs that follow the lymphatic systems for that type of cancer. So if you're treating a left lung that's in the lower lobe, and you're seeing all of these contours around the right side or the right-sided nodes, this is why, because it drains into the right lymphatic duct, into the brachia and the right superior paratracheal nodes, which is so unique. You know, you wouldn't think that way if it's on the left side of the body, but in this case, that's what happens. All right, moving on to the breast. The breast has the external landmarks of the breast. The breast has, I love this picture, it's so straightforward. We have the suprasternal notch. Remember, that's the little space right here between your two clavicles. The suprasternal notch and the clavicle actually marks the superior border of the breast. The lateral side of your sternum, you could say the body of the sternum and the manubrium and all that. The lateral side of that is what marks the medial side of your breast. And then the lateral aspect of the breast is actually marked by your mid-axillary point. So if you were to turn around and find that space between the mid-axilla, that's actually where the lateral border of your breast lies. And then the inferior sulcus is like where your breast attaches inferiorly. That could be the lower border. If your breast is large and it hangs under the inframammary sulcus, then your inferior border will go obviously along with the breast tissue. Other landmarks of the breast. So the tail of Spence is this fold that you can see coming down from the axilla laterally. That is known as the tail of Spence. The nipple is the small area in the middle, which is very easy to see on a breast. The areola is the darkened area around the nipple, and it actually changes based on hormones. So if you're pregnant and things like that, the areola will change in size and in color. And finally, the breast is divided into 4 quadrants. You have the upper outer. So you have the uppers and lowers, and the outers, laterals, and the inners, medials. Okay, so upper, above, near the axilla, upper outer quadrant, upper inner quadrant, lower inner quadrant, and lower outer quadrant. Most cancers are actually diagnosed in the upper outer quadrant, so near the axilla. And yeah, let's go to the next slide. All right, so the lymph nodes of the breast. Here we go, get a little bit more in depth. So there are 3 main pathways that your book discusses. We have the axillary lymphatic pathway, the transpectoral lymphatic pathway, and your internal mammary lymphatic pathway. So let's start from the lateral side. Laterally, we have the axillary lymphatic pathway. This is known as the principal pathway. This drains the lateral side of your breast, so the entire lateral side of your breast. If it's your left breast, the entire left side of your breast. If it's your right breast, the entire right side of your breast. So it's important in invasive breast cancer. This is where the first lymph nodes that get affected by the tumor, this is where you'll find them. This is typically the starting point of like metastatic cancer, breast cancer. It starts moving into these lymph node groups. And the ones that we're going to talk about in terms of the axillary lymphatic pathway are the anterior axillary nodes, which are actually in your breast. The posterior axillary nodes are sitting more like back by the axilla. The central axillary nodes right here, right above, basically what we call straight up the armpit, are your central axillary nodes. And finally, your apical axillary nodes are a little bit more above. So apical, it's talking about apex, which usually means like where the peak is. So in this case, that's what the apical is referring to, the peak of the breast, if you want to refer to it that way. Your transpectoral lymphatic pathway. Sorry, I made an oopsie there. Your axillary lymphatic pathway, we're talking about the central, the posterior, and the anterior. And then when we're talking about the transpectoral is when we talk about the apical. My oopsie there. So your transpectoral, the one that the book is trying to highlight for you is your Rodder's node. It's actually an infraclavicular node. So it is sitting beneath your clavicle. In this case, they pictured it here. And the other important transpectoral lymph node that they want to point out is your scaling node. This is a supraclavicular node. And it sits right here above the clavicle, and along with the other supraclavicular nodes. And these are found about 1 to 3 cm deep. The scaling node is the one that I mentioned earlier when we're talking about lung drainage, lung lymphatic drainage. It's a very important node. It's the one that they typically biopsy when a patient is diagnosed with cancer in the thorax. They tend to go straight to the scaling node to see if that one is affected. And if it is, then there's a very high likelihood that more lymph nodes are affected, or that this cancer has traveled outside of just the breast or just the lung. Let me reference the book, make sure that I'm not forgetting anything for you guys. Finally, the internal mammary lymphatic pathway. So internal mammary, these are the ones that are hugging your sternum. These are the medial nodes. These are, so yes, close to the body of the sternum, the cancer of the inner breast quadrants. So when you see cancer of the breast metastasize, if it is in an inner quadrant, you will typically see the internal mammary nodes being treated in radiation therapy. If it is of the outer quadrant, which remember that's the most common type, then you will see the axillary lymph nodes being treated. It doesn't mean that only the inner go to the internal and only the outer go to the axillary pathway. Not necessarily. You could treat both with a cancer of the outer, but it's just, you know, it makes logical sense. Cancer travels by ways of lymph, so it's not going to go from the outer portion and jump straight to the internal. It's probably going to have to travel there, and the same goes for the opposite. It's not going to go from a close point to the medial point of the breast and then just metastasize directly to the furthest axillary node. That doesn't make sense. What else? The internal mammary chain is 2.5 cm from midline, and it's actually 2.5 cm deep. Obviously, with technology nowadays, we're able to treat these with IMRT, or we're able to treat this with 3D fields. But back in the days, we used to use electron fields for these because they are very shallow. And we used to put a whole electron field abutting the whole breast field. I highly doubt you guys will see that in clinic nowadays. But your internal mammary nodes will be on your boards. I remember these on my boards. So make sure you do know where these are lying and what they are in reference to. That's it. Very quick lesson this week. The readings are very short, but again, we're going to go over a lot more of this anatomy in e-contour so that we can all be sure that we can identify all these structures in CT scans. Have a great week, everybody, and I'll see you guys next week for the next lecture. Bye.